Patient and public involvement is an important topic, but one that many researchers are still not sure about what it is or how to do it. So we have developed a number of short videos to help break this down. Patient and public involvement is research that is done with or by members of the public, rather than to, about, or for them. The public can include the general public, carers, family members, or patients from different backgrounds with different conditions. But why should we do it? Well, it's important to involve members of the public in research in order to improve its quality and its relevance. When we design research alongside the people for whom it's intended, we're much more likely to develop protocols and studies that suit the needs of the potential participants. This can help improve study recruitment and retention rates because potential barriers are identified early. Members of the public also bring a different perspective and a lived experience of a condition that researchers typically do not have. Therefore, they can help us to identify what is important to them for us to explore. Beyond this, more and more funding bodies and regulators are asking researchers to provide evidence and plans for the public and patient involvement that underpins their research. In fact, if researchers do not include it, it is becoming necessary for them to explain why. Finally, to bring this back to basics, people who are affected by research have a right to have a say about it. Public involvement is an important part of accountability and transparency that can empower people who use health services by being in a position to influence them directly. When speaking about public and patient involvement, it's important that we know what it is and the levels associated with it. There are typically 3 levels of involvement in research, and ideally, a research project should include all 3 levels. Participation is one level and is perhaps considered the lowest form of public and patient involvement. This is where members of the public are participants in research, specifically in research that asks for their opinion. So, for example, a survey, interviews, or focus groups. Here, participants provide insights into their lived experiences. However, they are providing researchers with data, and so they are not equal partners in this relationship. Involvement is the next component of public and patient involvement. This is where members of the public are equal partners in the research process, or are active members of the research team. This can and should be at all aspects of the research cycle. Here, members of the public are supporting researchers in the development and implementation of research projects. Finally, then we have engagement. This is where we link in members of the public about research by sharing information or results. This can happen alongside involvement, or it can be separate to it. Although all of these components are important, it is involvement that is becoming the main focus of future work, as this is the component that sits the public beside researchers as equals. Involvement activities include anything that is part of the research process. The key is that the research is developed with the insights, recommendations, and perspectives of the public. This includes, but is not limited to, co-designing applicants for grants, co-designing protocols, producing patient-facing information leaflets, supporting data interpretation, co-authoring publications, or acting as members of advisory or steering groups within projects. We recognise, for those who have not done public and patient involvement before, that it might be difficult to know where or how to start. As part of the network Cost Action, we wish to support people by providing examples and research about how to do this, complete a workshop to support researchers in understanding more about it, and also to engage with the public about how best to include them in future osteoarthritis research. Our next steps will be to populate our website with these resources as we progress the network going forward.